If you're watching this, you're likely in a frustrating and heartbreaking place. You've done everything your doctors told you to do. Maybe you've even been through rounds of IVF or endured multiple losses, and you're still left with more questions than answers. You're told your labs are fine, your hormone levels are normal, but deep down, you know something is off. You're not broken, you're not crazy, you simply haven't been assessed on the right level. This is where my program comes in. We go beyond surface level diagnostics and uncover the biochemical and cellular patterns, especially in your mitochondria and metabolism, that truly determine fertility success. You're in the right place if you want to finally understand what's going on inside your body and take back control. And why should you listen to me? Well, I'm Dr. Mandy Dow. I'm a doctor of clinical nutrition, certified nutrition specialist, and root cause practitioner. I help women like you heal from complex conditions, things such as interstitial cystitis, chronic UTIs, hormone imbalances, gut issues, and fertility challenges using advanced clinical testing and personalized care. I've been through these issues personally, and that experience deeply shapes how I work with my clients and patients. Welcome. If you've been trying to conceive and haven't gotten answers, you're not alone. Most fertility specialists focus on hormone levels, ovulation induction, or procedures like IUI and IVF. But the root cause of infertility often goes much deeper into how your cells produce energy, clear toxins, and utilize nutrients. These critical processes are almost never explored in conventional fertility workups. That's why my approach is different. Instead of guessing, I use a proprietary fertility blueprint method that reveals hidden barriers at the cellular and biochemical level. This gives us the clarity to design a precise, personalized fertility optimization plan so we can restore your body's natural ability to conceive and carry a healthy pregnancy. Now let's dive into the mitochondria, arguably one of the most important yet overlooked aspects of reproductive health. Mitochondria are the powerhouses of your cells, generating the energy needed for egg maturation, fertilization, and embryo development. In fact, each mature egg contains about 100,000 mitochondria. That's because early embryo growth relies entirely on the energy your cells store before fertilization. When mitochondria don't function optimally, whether from aging, oxidative stress, toxins, or nutrient depletion, fertility suffers. Eggs may not mature properly, embryos may fail to implant, and even IVF success rates decline. That's why mitochondrial health is at the center of my fertility blueprint method. This proprietary approach uncovers hidden energy and cellular imbalances that standard fertility workups miss, giving us the roadmap to restore your body's natural ability to conceive and sustain a healthy pregnancy. Right now, some women are flocking to procedures like mitochondrial transfer. On the surface, it sounds promising. Let's replace your weak mitochondria with healthy donor ones. But here's the truth. It's experimental, very costly, and has very limited data on long-term safety and outcomes. It doesn't address why your mitochondria aren't functioning in the first place, so the underlying issues still remain. And most importantly, you cannot outsource your biology. Optimizing your own mitochondria through root cause work consistently leads to better outcomes, not just for conception, but for sustaining a healthy pregnancy. That's why in my fertility blueprint method, mitochondrial health is a top priority, because when your own energy systems are restored, your body knows exactly what to do. Here's something your doctor failed to tell you. Nutrition is one of the most overlooked yet powerful tools to improve mitochondrial health. Your mitochondria, the powerhouse of your cells, cannot function without the right cofactors. These include nutrients that transport energy, activate enzymes, and protect against oxidative stress. If you're low in these nutrients, and many people are due to stress, digestive issues, or dietary gaps, your mitochondria simply can't do their job. In my program, I uncover these hidden nutrient patterns as part of my fertility blueprint method. This allows me to design a precise, personalized plan using nutrition and supplementation to restore mitochondrial strength. When your cells are nourished, your reproductive system can finally function the way it was designed to do. One of the most underestimated threats to fertility is environmental toxicity. Chemicals found in plastics, pesticides, and heavy metals don't just disrupt hormones, they impair your mitochondria's ability to produce energy. These toxins trigger oxidative stress and damage mitochondrial DNA. The result? eggs that don't mature properly, embryos that fail to implant, or pregnancies that don't progress. Even if you're doing everything else right, these hidden toxic burdens can silently sabotage your fertility. That's why in my Fertility Blueprint method, I uncover these hidden toxic patterns and create a customized detoxification and repair plan. By gently restoring balance and strengthening your cells, we optimize your body's ability to conceive and carry a healthy pregnancy. Endocrine disrupting chemicals, or EDCs, are substances that mimic or block your natural hormones. They're found in plastics, cosmetics, pesticides, food packaging, flame retardants, you name it. These chemicals interfere with your endocrine system, altering estrogen and progesterone signaling, suppressing ovulation, disrupting thyroid function, and even impairing implantation. Over time, EDCs contribute to conditions like PCOS, endometriosis, irregular cycles, and unexplained infertility. Despite their well-documented effects, EDC exposure is almost never discussed in standard care. That's why my Fertility Blueprint method goes deeper, uncovering hidden hormone disruptors and mapping how they affect your body's ability to conceive. From there, I create a precision strategy to reduce toxic load, restore hormone balance, and optimize your chances for a healthy pregnancy. The traditional medical model is based on diagnostic thinking. Identify a disease, prescribe a drug or procedure. But that doesn't work when you're not technically sick, just not getting pregnant. Most of my clients come to me saying, I feel off, but everything's normal. That's where my approach is different. Instead of relying on diagnostic markers, I use my Fertility Blueprint method to map how your body is actually functioning at the cellular level. This method examines interconnected areas like mitochondrial health, inflammation, hormones, detoxification, gut balance, and nutrient utilization. These are blind spots in conventional fertility workups, but they hold the key to unlocking your fertility potential. With this deeper insight, I can design interventions that go beyond symptom management and instead restore your body's natural ability to conceive and carry a healthy pregnancy. My approach goes far beyond looking at single numbers on a lab report. I use advanced functional analysis to see how your body is performing as a complete system at the cellular, hormonal, and metabolic level. This allows me to identify hidden factors like oxidative stress, energy deficits, nutrient depletion, or toxin overload, things that directly affect egg quality, hormone balance, implantation, and embryo development. I also evaluate how inflammation and immune balances may be silently sabotaging your fertility even if your standard labs look normal. What makes this unique is that I don't rely on trial and error. Using advanced modeling, I can simulate what's likely to happen if you make certain changes, so we can skip the guesswork and go straight to what's most effective for you. This is how I create a precision fertility plan tailored to your unique biology, helping you not only conceive but sustain a healthy pregnancy. My Fertility Blueprint method allows me to go far beyond traditional hormone panels or blood tests. Instead of just looking for disease, I evaluate how your body is performing functionally at the cellular level, which is absolutely critical for fertility. This deeper view shows us things standard blood work misses. For example, it may reveal your mitochondria are struggling to produce energy, your antioxidant defenses are low, or your hormone signaling is suboptimal. These hidden imbalances can silently block conception even if your labs look normal. Now, it gives me insight into whether your body is resilient to handle detox or whether we need to first focus on rebuilding energy and nutrient reserves. That's key if you've already been through supplement-heavy protocols, multiple practitioners, or even IVF without success. Think of this as a strategic fertility map, a way to see exactly what needs to be restored, nourished, or gently cleared so your body is more receptive to conception and pregnancy. This precision approach is especially powerful for women with unexplained infertility, PCOS, endometriosis, or those who've had failed cycles because it finally shows why things haven't worked and how to change it. My Fertility Blueprint method provides a comprehensive snapshot of your body's readiness to conceive. First, I evaluate mitochondrial function, the energy powerhouses of your cells. If your mitochondria are stressed, your eggs won't mature properly, embryos won't implant, and even IVF success can be compromised. Second, I assess nutritional status, not just what you're eating, but whether your body is actually absorbing and using key nutrients like vitamins, amino acids, and essential fatty acids. These nutrients are critical for egg quality, uterine lining development, hormone production, and detoxification. I look at the hidden inflammation and toxic burden, two silent disruptors of fertility. Inflammation can sabotage implantation, while impaired detox pathways can throw hormone balance off track. So we pull all this together: mitochondrial health, nutrient utilization, toxin clearance, inflammation, and hormone metabolism. And then I can create a personalized protocol designed specifically for your fertility goals. Whether you're preparing for IVF or trying naturally, this roadmap ensures we address the exact barriers between you and your pregnancy. So this chart illustrates the kind of transformation that's possible with just 6 months of using my Fertility Blueprint method. So when Jane came to me, her baseline health showed some suboptimal performance across every fertility relevant domain, especially mitochondrial health, hormone balance, and detox pathways. I designed a precision fertility protocol tailored to her needs and results. This included mitochondrial support to improve energy production, anti-inflammatory strategies, nutritional corrections to support reproductive hormones, and gentle detoxification to clear hidden toxin burdens. The outcome? Follow-up assessment showed dramatic improvement across multiple domains, including endocrine and mitochondrial health, two of the most critical systems for fertility. So this can demonstrate what happens when we shift away from surface-level diagnostics and take a true systems biology approach to fertility optimization. Minerals are like the spark plugs of your body. They activate enzymes, regulate your thyroid and adrenals, and support hormone signaling, all of which are critical for fertility. When minerals are out of balance, we often see patterns like adrenal fatigue, sluggish thyroid, copper overload, or toxicity, or calcium shelves. These imbalances can quietly interfere with egg quality, hormone balance, detoxification, and even mitochondrial function. That's why, as part of my Fertility Blueprint method, I evaluate mineral patterns to uncover how your body is wired at a metabolic level. From there, I simplify the supplementation into a streamlined, personalized formula that corrects imbalances at the root. No more guesswork, no more supplement overwhelm. Just exactly what your body needs in the right ratios to restore balance and optimize fertility. Minerals are the foundation of your metabolism. They regulate hormones, blood sugar, thyroid, adrenal, and detoxification, all of which are critical for conception and a healthy pregnancy. As part of my Fertility Blueprint method, I analyze mineral patterns to see how your body is functioning at a deeper level, not just in the moment, but over time. This shows whether you're in a stress pattern, how well you're handling blood sugar, whether your thyroid is sluggish, or if your adrenals are overworking. I can also look at toxic metal exposure, which can quietly accumulate and impact egg quality or early embryo development. This is especially relevant if you've experienced multiple miscarriages, chemical pregnancies, or unexplained infertility. With these insights, I designed personalized mineral protocols to restore balance and optimize your metabolism to prepare your body for pregnancy. For women preparing to conceive, this can even translate into a truly personalized prenatal approach, so you're not relying on generic supplements that may give you too much of some nutrients and not enough of others, or the wrong forms. The result is a clear, actionable roadmap to get your metabolism, hormones, and detox pathways working with you instead of against you on your fertility journey. This slide shows some of the most common mineral patterns I see in clients who are trying to conceive or struggling with hormone balance. Now keep in mind, you're not going to find a lot of these in standard blood work because blood work is homeostatic. So you have to understand that there has to be a combination of different labs to understand the patterns, and it's not the blood that does that. These aren't random. They have a direct impact on your ability to get pregnant and stay pregnant. So for example, magnesium is important for egg quality, muscle relaxation, stress regulation, and progesterone. When it's low, women experience PMS, anxiety, and poor embryo quality. We often see calcium with low potassium patterns, and this often is pointing to a sluggish thyroid, a very huge deal for fertility. A slow thyroid can suppress progesterone and ovulation, leading to luteal phase defects or irregular cycles. I see a lot of high copper to low zinc ratios, and this is linked to estrogen dominance, usually heavy periods, mood swings, breast tenderness. Copper and zinc must be in balance to support estrogen detox and immune function, which you absolutely need for pregnancy. And then I often see people with a slow metabolic pattern when the body is in rest mode metabolically, energy is low, detox is sluggish, and hormone signaling is downregulated. In this state, your body prioritizes survival and not reproduction. And finally, I often see elevated toxic metals, which can show a buildup of things like lead, mercury, or aluminum, which can damage egg quality, interfere with hormone receptors, and even increase miscarriage risk. These hidden toxic burdens don't show up in routine blood work. So this is the beauty of the Fertility Blueprint method. It reveals these patterns and then translates them into clear, targeted solutions. And then I can create a precision mineral and nutrient protocol that rebalances your system and optimizes hormone signaling and prepares your body for conception. It's simple, non-invasive, and incredibly actionable, and explains what standard blood work has actually missed. So here is my signature program you've been waiting to learn about. It's called the Fertility Optimization Program, and it's a 6-month journey where I take you step by step through uncovering the root causes of your fertility challenges and correcting them with a personalized roadmap. It begins with 3 to 6 advanced labs chosen specifically for your needs. We'll then meet for a 90-minute deep dive consultation where I create your fertility roadmap. From there, you'll have step-by-step action plan aligned with nutrition, supplements, cycle tracking, and lifestyle changes. You'll also have ongoing messenger support for questions, and we'll meet monthly over a 30-minute check-in to track your progress and make adjustments. That way, you'll never feel lost. You'll always have guidance, and accountability throughout your fertility journey is always there for you. What makes us different from other fertility programs is it doesn't just run labs and send you off. My system looks at how your body works as a whole and then applies precision strategies to correct imbalances. And because you have ongoing support with monthly check-ins, you're never felt wondering what to do next. The real value of this program is in the transformation. Clients gain clarity on why pregnancy hasn't happened, experience more regular cycles, and see improved egg quality and reduced inflammation and stress. But most importantly, they finally feel confident and supported with a plan. If this resonates with you and you've been told your labs are normal, if you tried different approaches without answers and you're ready for a personalized roadmap, then this program may be exactly what you've been looking for. I know some of you may be thinking, but should I just stick with my doctor or fertility specialist? Well, conventional fertility does play a role. It has many limits. First of all, it focuses on hormones and procedures and tells you that everything is normal even when you can't conceive. The usual solutions is medication or IVF, but that doesn't address why your body isn't functioning optimally, and in fact, it can actually push you further into more of a disease state. And here's something most women don't realize. If the root causes are left unresolved, you may not just struggle to conceive, you may face challenges during pregnancy, delivery, or even with your baby's health. My Fertility Blueprint method changes that. It looks deeper at your energy, detox, hormones, nutrients, and stress patterns. By optimizing these foundations, we not only increase your chances of conception, we also support a healthier pregnancy, delivery, and baby. This isn't about choosing between conventional and my method. It's about giving yourself the strongest foundation possible so that everything else you do will work better and safer. The next step is to book your discovery call. This is a paid call because my time and expertise are valuable, and if someone isn't willing to invest in a conversation, they aren't ready to commit to the level of work this program requires. So consider this a screening. On the call, we'll go deep into your fertility history, what's been holding you back, and whether the program is the right fit for you. It's not much of a sales pitch, it's a focused consultation. The founder and creator of Blueprint Method, me, will be leading this call. My clients don't just want answers, they want results, and I can deliver them. If you're ready to give this journey 100% and avoid the regret of not doing everything you could, then book your discovery call today. Every cycle matters. Don't waste another one. And finally, why should you work with me? I come from a rigorous academic and clinical background with a doctorate in clinical nutrition, a master's in biology, and board certifications in clinical and functional nutrition. But more importantly, I've lived through these things, such as IC, chronic pain, food sensitivities, and fertility struggles. I was told there was no cure, no answers, and I was just too old. Functional medicine changed my life, and I've now helped hundreds of women transform their health using the same root cause approach, and I would love to help you do the same.